Hi, everyone. Thank you so much for joining us today, and welcome to today's webinar. This is part of our 2021 Research in Progress webinar series on preventing adverse childhood experiences and child maltreatment. I'm Sarah Brandspiegel. I'm an instructor at the Colorado School of Public Health, and I work with our Program for Injury Prevention, Education, and Research, also known as PIPER. And we facilitate this webinar series as part of the National Peer Learning Team on Child Maltreatment Prevention, which is funded by the CDC, and it's a collaboration between PIPER and the Colorado Department of Public Health and Environment. So thank you so much for joining us today. We're excited to learn about a research study exploring the effectiveness of adverse community experiences and resilience and community organizing for preventing youth violence and ACEs. So before I introduce our speakers, I'll do some quick housekeeping. First of all, welcome to Zoom webinar. You can use the Q&A feature to ask any questions. So throughout the session, feel free to put your questions in, and we'll have time reserved at the end of the presentations to go to your questions. Also, this session is being recorded, and the link will be sent out after with slides, and we'll also post it to our website. And finally, when you close out of the session, a feedback survey should pop up, and please take a few moments to share your feedback on today's webinar and also any suggestions for future webinars and topics that you'd like us to cover. All of our past webinar recordings and slides are available on our website. I'll put that link in the chat in a few minutes. And so you're welcome to go check these out. We've had about one webinar per month going on for the past year. So you can see all of those recordings as your interest leads you there. And then also I wanted to announce that registration is open for an option that might be of interest for some of you. It's the Kemp Interdisciplinary Research Institute hosting a fall semester hybrid course on child abuse and neglect prevention. And this course is designed for practitioners working in community-based settings with a focus on child health and welfare, and also practice-focused graduate students. The deadline is August 9th, so you have a little bit of time, but the course leaders are Carol Runyon, who co-leads this effort, and also Megan Shanahan, who presented one of our webinars a few months ago. And Carol is here with us today, so if you have any questions about this opportunity, you're welcome to put those in the chat, and she can respond to those. But you can learn more here, and I'll send out the link to those who registered if you want to get some more information about this opportunity. So now I'd like to introduce our four presenters today, and then I'll turn the floor over to them. And so we are very pleased to have them here sharing their work with us. We have Anna Yaros, who's a licensed clinical psychologist with prior experience providing mental health services to children, adolescents, and adults in a variety of settings. And her expertise includes risk and protective factors and preventive interventions for mental health promotion and other elements of youth well-being. And she serves as the director of RTI's Mental Health Risk and Resilience Research Program. So we're very pleased to have Anna here. We also have Jamal Smith, who's the Violence Prevention Manager in the Office of Violence Prevention at the City of Milwaukee. He's a proud native of Milwaukee and a graduate of Milwaukee Public Schools, and has committed the last 10 years of his life to serving the Milwaukee community. He earned his bachelor's degree in computer science from Alabama State and a master's in public administration from the University of Phoenix. And we're so glad to have you here, Jamal. Welcome. We have Dana Fields Johnson, who's an associate program director at the Prevention Institute, a national nonprofit dedicated to advancing primary prevention and promoting safe, healthy, and equitable communities. And in her role, Dana works to promote healthy communities with a focus on strategies that prioritize community determinants of health and multi-sector solutions that prevent violence, injury, trauma, and substance misuse. So welcome. And finally, we have Dr. Phillip Graham, who's the PI of this study that we'll be hearing about today. Dr. Graham is Senior Director of RTI's Center on Social Determinants, Risk Behaviors, and Prevention Science. And he has more than 20 years of experience conducting community-based research and evaluation, with research focusing on evaluating preventive interventions developed to reduce and prevent adolescent interpersonal violence and substance use. So I'm very glad to have you all here. I'm going to turn off my screen share so that Dr. Yaros can pull up the slides.
Thank you so much, Sarah. Let me get those shared and make sure everyone can see. Are those popping up now?
They look great.
Great. Thank you, Sarah. Well, hi, everyone. Welcome to the webinar today, and thank you for that introduction, Sarah. We're so excited to be joining everyone and be able to talk a little bit about our project today. As Sarah mentioned, Phillip and I are from RTI, and we'll be speaking about the research piece of things. We have Dana and Jamal presenting about implementation. So just a little bit of background about how we got here. We are all really interested and focused on adverse childhood experiences, as I know many of you, if not all of you, are on the phone call. We also know that this is CDC's particular area of interest for this solicitation for R01 research that we applied to fund this project. Many of you may have been exposed to this graphic. It's really illustrative of the ACEs and the adverse childhood experiences that we typically think of as branches of a tree, but really relying on some of the underlying roots and root causes, if you want to use a literal interpretation, the roots of the tree, of those ACEs that we sometimes think of as adverse community environments. So that's things like poverty, discrimination, poor housing quality, and a number of other challenges in communities that we're going to talk a good bit about today. So with that lens and perspective, we knew that we could hopefully come up with some ideas to address violence through the way that CDC would like to, using this concept of adverse community environments. So in doing so, we were able to try to understand better what the Injury Center at CDC was interested in funding, and really turn to who we know to be the key practitioners of violence prevention in communities, which is Prevention Institute. So we've been developing a partnership with Prevention Institute and are thrilled to have this research project to add to our list of partnerships, because quite frankly, they get it. They get what they're doing. They understand communities and the prevention that needs to happen there. And I think you'll see some of that today. And turned to include one of their closer partners, which is the Office of Violence Prevention in Milwaukee, Wisconsin. And so you'll also understand from Jamal's presentation that Milwaukee is out ahead of many communities and understanding and addressing violence with a different lens, a holistic lens that I think you'll hopefully find interesting today. So our RTI research team, Sherry Spinks in the bottom right corner is our project manager. She's the elusive non-picture person. But Phillip and I lead the project. Jessica, Dr. Kantz, Dr. Rudenauer, Dr. Ramos, and Kamara Wooten, also who is on the call, are our wonderful team. And we are hoping to discuss the research study, but we'll get to it last. So we'll start off by discussing the Acer model, which Dana will explain, and then go into a description of what that means in Milwaukee specifically. And so Jamal will introduce the Milwaukee blueprint in more detail. And then we'll end with a description that Dr. Graham will provide about what that means for the research study that we're doing and how we're trying to add to the literature using this good example of community intervention. So I'll turn it over to Dana Fields-Johnson from Prevention Institute.
And hello, everyone. Had to make sure I unmuted, and I'm usually muted some way or another. But hopefully everyone can see me and hear me. And thank you, Anna. I'm excited to share more about the adverse community experiences and resilience framework, and more particularly about how it's being connected to helping communities better understand solutions to trauma, and how our partners in Milwaukee are connecting it to community organizing strategies to accelerate their work. Next. The Adverse Community Experiences and Resilience Framework, or how we like to call, as we like to call it, Acer, came about as a result of work we were doing with a number of health departments across the country in 2016, working to apply collectively a violence as a public health lens approach to addressing violence. And in our conversations, one of the things we kept hearing over and over again was the connections and links between violence and trauma. But what we were hearing wasn't necessarily what we commonly understand as individual trauma or trauma that can be treated through a medical model, trauma-informed care, or through services and treatment. They were really describing more a model of trauma that was connected to the community environment. So we began to study this with our partners, and this was led by Dr. Howard Pender-Hughes at University of California, San Francisco, along with our executive director at Prevention Institute, Rachel Davis. They led the literature review and a series of interviews with partners. This led to the development of work in our understanding of community trauma. And so what you see on this screen is some of the publications that have been produced and are available on our website to help you unpack this a little bit more. Next slide. And so what did we learn? We learned that community trauma is more than just the aggregate of individuals in a neighborhood or in a community experiencing trauma. This was trauma that's manifesting at the community level and really observed in the community environment. Community trauma is the impact of chronic adversity across a community, trauma that's to violence, but not just violence, also structural and systemic violence. It's the kind of trauma that comes along with living in a place that promotes isolation, disconnectedness, distrust, disorganization. And what our partners really were saying and helping us to understand that it was really important to understand this more because it was getting in the way of them putting in place effective solutions and strategies to address community health and well-being. Next slide. So when we look at the community environment, we can see manifestations or what we call symptoms of community trauma. And we can see those across three aspects of the community environment. What we like to talk about is people or the sociocultural environment, place or the built environment, and then the equitable opportunity environment. And that really is about the economic and educational conditions of a community. And examples of ways that that plays out in community environments is through damaged social networks, high availability of unhealthy food, a low sense of social and political efficacy, environments and disinvestment, and chronic intergenerational poverty. Next slide. How do we address community trauma? It really requires actions then at the community level, really putting in place solutions to address what's going on in the community environment. Strategies that address individual trauma are needed, but really what Acer helps us understand is that a more comprehensive approach that considers the community environment is also needed. And this means considering the impact of violence and structural violence on disadvantaged communities, and structural violence being the type of violence caused by systems and institutions that inflict harm on communities through the inequitable distribution of money, power, and resources. Next slide. So this slide puts forth a visual that we created in our early work that helps us understand the need to address trauma at the community level, so that we're not sending people back into the same communities and the same conditions that are contributing to their trauma. We know that through, again, individual approaches to address trauma, people are receiving trauma-informed care and mental health services, but really a more comprehensive approach is needed, again, that addresses people, place, and equitable opportunity. Next slide. So the strategies that have emerged to address and prevent community trauma really have to center around healing as a starting point. And then moves out to really putting in place strategies to address people, place, and equitable opportunities. And then moves to address those systems that are important to creating resilience and helping people stand against some of those stressors in the community environment. And you see some of those systems in that outer band. And healing really at the community level looks quite different from individual healing through the medical model. Healing collectively as a community, you know, some of the ways that we have seen communities do that and focus on that is through healing that is rooted in cultural practices, through healing circles, community dialogues, through arts and engagement in arts and culture, and then again through restorative justice practices. Next slide. So now we'll get into just a little bit about how Acer is being applied. We've seen it and worked with communities across the country to apply it as a lens to really understanding what prevention of substance abuse looks like. We've seen it applied to mental health and well-being, to healthy eating, active living work, community and economic development, and then to really apply it to addressing reduction and prevention of violence. And so our partners in Milwaukee really recognize Acer as an important framing as they started their work on the Blueprint for Peace back, I believe in 2016 or 2017, but Jamal will really help you unpack that a little bit more. Next. So I think I see where somebody's saying there are audio issues. Is that still the case, or am I coming through okay?
You sound just fine to me.
Okay, great. Just wanted to do a check-in. So this slide really, this comes directly from the Blueprint for Peace and shows you how and what some of what they learned when they use the adverse community experiences and resilience framework to think about risk factors for violence in Milwaukee. And some of the things that emerged, a few of those things were segregation from opportunity, availability of illegal guns, limited trust between community and government, and harmful norms that really were creating a culture of fear, and also homelessness. Next slide. So fast forward to the work we've been doing recently as a part of this project. Milwaukee has been working with community partners, governmental partners, and residents together in the development of the blueprint. And in that work, we were able to really observe that their work was rooted in strong community organizing approaches, and that these approaches were connected to and needed to build equity, resilience, and most of all, hope in communities disproportionately impacted by violence. Next slide. Using that same community organizing approach, OVP continues to place emphasis on increasing resident voice, agency, and leadership in not just the development of the blueprint, but now also in the implementation of the blueprint. And they're accelerating their work through a focus on 4 distinct components of community organizing, which you see here: civic engagement, community organizing, and movement building. And part of our work has been really understanding how Milwaukee Office of Violence Prevention is approaching each of those and how they operationalize each of those things. And that's helped us to understand how residents are engaged, what skills and resources are needed, shared leadership and ownership of the blueprint. And it's also helped us understand community organizing as a critical element of healing in a community. Next slide. So our work with OVP and RTI is focused on understanding community organizing as an effective strategy to reduce adverse childhood experiences, and in particular, child abuse and neglect, as well as other forms of violence. And as a part of this, we brought together residents and other organizational partners to be a part of a design team that's informing our work and helping us understand the capacity building needs that exist for residents to be able to lead this work. And they're also helping us to co-create and design resident leadership training that integrates concepts of the adverse community experiences framework with community organizing practices and approaches. We hope to begin piloting this work in one of the Blueprint's prioritized neighborhoods, Sherman Park, next month. And then we also hope to move to taking that to other prioritized neighborhoods, and we're looking at 3 others. And then from that work from those trainings across those 3 communities, one of the other things we hope to do is develop a neighborhood readiness assessment, learning from those trainings and learning from our conversations with residents and organizational partners in those neighborhoods, what it takes for residents to come to the table and to organize and to collectively start working on neighborhood and community improvements to neighborhoods and their community environments. Next slide. So beyond the research goals of this project, our ultimate goal in this work is really to understand what's needed to counter adverse community experiences and the impact on community environments. And more importantly, really to build up resilient community environments that are necessary for communities that have been disproportionately impacted by violence and structural violence, to not just withstand those stressors, but to also achieve their full potential for health, safety, and well-being. Next slide. So before turning this over, I just want to acknowledge the other members of our Prevention Institute team who are working on various aspects of this project with me. Sheila Savannah is our managing director who oversees our safety and well-being portfolio at Prevention Institute. We are also joined by Nzinga Khalid and my colleague Cami Yamamoto in this work. So that's a little bit about the Acer framework, how it's being applied and how it really helps us understand community trauma and the importance of addressing community trauma through actions in community environments. And I'm now going to turn it over to Jamal, who's going to help us understand more about the Blueprint for Peace and their work through the Office of Violence Prevention.
Okay, thank you, Dana, for this presentation. Thank you for your presentation. Thank you, everyone, for joining this webinar. Definitely an honor to be here, to be a part of this discussion on very key conversation around violence prevention. Again, my name is Jamal Smith, the Violence Prevention Manager for the Office of Violence Prevention in Milwaukee, Wisconsin. And a little background about the Office of Violence Prevention. We were established in 2008 under the leadership of then Executive Director Terry Perry, with the idea of really beginning to elevate strategies around domestic violence and sexual assault, which are definitely still commonplace in terms of the work that's happening around violence prevention. But there became a shift. A shift was needed after there was a major uptick in violence that happened within our city. In 2015, we saw one of the deadliest years in the city of Milwaukee, where we went from 86 homicides in 2014 to 145 homicides in 2015. So Mayor Tom Barrett came together with key stakeholders and partners, and under the leadership of Reggie Moore, who became the executive director of OVP in 2016, decided on ways to take the look at violence prevention from a public health lens, right? For so long, we've always responded to violence with a punitive measure, a punitive lens, or punitive strategies without thinking, well, what has been the root cause or have been the root causes leading to those acts of violence in the first place? So in that process, began to bring together key stakeholders from multiple sectors, as well as systems partners, residents groups, and the likes, which we'll talk about shortly, just for the development of the Blueprint for Peace. But here are just a few of the initiatives that we work on here for the Office of Violence Prevention, starting with the Commission on Domestic Violence and Sexual Assault. Those efforts are led by Karen Tyler, who was our Family Violence Prevention Manager. And a lot of the work is centered around bringing together those partners that specifically work towards domestic violence and sexual assault to figure out a better way for collaboration. Oftentimes, we've seen that type of work operate within a siloic approach, but even Malcolm X said that when you replace I with we, illness becomes wellness. So changing from an individual focus to a collaborative focus is brings about the ability to expand capacity around domestic violence, sexual assault work. Next, we have our recast program, which elevates the mental health services as well as trauma reduction, whether that's individual or community trauma. That is actually led right now by Arnita Holloman, who was recently appointed to be our newest executive director, the first African-American woman to be the director of the Office of Violence Prevention. But right now, she's also in the capacity of a program manager for our recast program. Our 414 Live team is our violence interrupters who are dispatched in different areas across the city of Milwaukee, focusing on conflict resolution and de-escalation. This has been a very, very critical work that has happened in our city as they have been able to de-escalate since their inception in 2019. They've been able to de-escalate over 150 potential violent situations that could have led to homicides or any further damage happening physically. And they've been very key in that work. The Build Health Challenge is a grant that we were awarded in partnership with Ascension St. Joseph, United Way, and the Sherman Park Community Association to work on health equity strategies with residents in the Sherman Park neighborhood to elevate the opportunity for there to be better access to quality of life, which can change the trajectory of the neighborhood of Sherman Park. And hopefully we will take that as a pilot moving into different areas across the neighborhood. And then ultimately the Blueprint for Peace is the foundational work, a community-driven strategic plan that has been elevated and used as a means to work towards transformative violence prevention. Next slide. So this is just a diagram just really explaining, I won't go into full detail, but just explaining a little bit of how we focus on violence prevention from our lens, whether that's looking at through a community lens, a youth, focusing on youth or families, and ultimately using that, elevating or assisting those three areas by using the Blueprint as the foundational model. But if you just look at really quick, look at the on the lower right quadrant, Dana talked a little bit about structural violence and the impact of systems and structures and how they have committed violence on particular neighborhoods or particular residents, even as detrimental as we've seen with individual and interpersonal and communal violence. And one of the aspects that we look at is safe workplaces. So not only are we targeting areas where unemployment and underemployment is a major issue in the city, but then also having conversations with employers on how are you developing your workplace to ensure that that is a safe culture for everyone to feel as if they are adequately accepted and belong in that culture. And when that is being shaken, then that's another form of violence. So looking at this is just a way of understanding that there is a full spectrum of violence that we're looking at, not just what has been given on the surface and what we see on the media every day, but there are multiple ways in which we have to address the complexities of violence. Next slide. So here's just a breakdown of the development of the Blueprint for Peace. Again, this was started in 2016. This was a 12-month process, very grueling process, something that we did in partnership with the Prevention Institute under the leadership of Dr. Pender Hughes, along with Dana and Sheila and others. But bringing together, again, key stakeholders, and from multiple sectors, whether that's in the employment field, criminal justice, law enforcement, healthcare, education, all of those systems partners were a part of these discussions, but then also grassroots organizations, grass tops organizations, neighborhood associations, residents groups. All of those groups came together with the idea of saying, these are the best ways in which we really need to address violence. What's most appreciated about this blueprint is that this was not a bureaucratic approach. This was not another government entity coming in, doing a survey and doing a study and saying, this is what we found to be best in terms of addressing violence within neighborhoods that are impacted highly by it. But let's talk to those who live in those communities that are highly impacted by violence and discuss what are the solutions they believe would be the best way to alleviate the violence within their neighborhoods. Also, a key contributor to this to the Blueprint for Peace was the fact that we were able to survey over 1,000 youth in the city who contributed mightily to the development of the blueprint and gave awesome ideas on what they thought would be contributing factors to violence prevention as well. And then ultimately, we had a launch event, which Prevention Institute attended. The mayor, representatives from state legislature were there, and just really bringing about this project of saying this is going to be a work that is not only going to be beneficial for Milwaukee, but then ultimately can be duplicated across the state and potentially across the country. And now we are seeing that there are other cities within America who are also trying to develop their own version of the Blueprint for Peace. Next slide. So here are the guiding principles of the blueprint, starting with community, understanding that we have to elevate the power, the connection, and the engagement within communities in order to adequately address that. And the objective is to ensure that those who are in those communities that are highly impacted by violence are the ones that are helping to drive the work to alleviate or to eradicate that violence from happening. Next slide. And then principle 2 is talking about equity. So it's really noticing that although violence happens in neighborhoods across the city of Milwaukee and across the state of Wisconsin, understanding that there's an inequitable toll that is happening in terms of violence on respective neighborhoods, especially those that are not only impacted by communal violence or impacted by interpersonal violence, but also heavily impacted by systemic violence, right? We have to understand that that the state of Wisconsin has 2 cities that were voted the worst for African Americans in the country. Milwaukee was number 1, Racine was number 2, right? So understanding that there is a level of violence that is inequitably happening on respective communities throughout the city of Milwaukee, and being willing to acknowledge that. So then we can go to the principle 3 of individual and community resilience, is understanding how do we bring about asset-based solutions, place-based solutions and asset-based solutions, right? To bring about a change within the immediate as well as a long-lasting change. And then ultimately, principle 4 is bringing that to action, right? There'd be no purpose of planning out or having discussions about solutions or having strategic planning sessions without putting any action that is comprehensive, actionable, measurable, smart, that's able to be seen, that has a timetable where it's happening within short term, medium term, or long term. You know, that this is all being planned out and being put into a form where residents are not only seeing that conversations are happening, but there's actually something happening to make those changes occur. Next slide. So here's the example. I know Dana and Anna have both discussed before about the model of the Acer framework, but here's how we look at it in terms of Milwaukee, right? Of understanding that equitable opportunity is necessary. And I told about how there has been reports that are showing that Milwaukee and Racine are the worst cities for African Americans in the country, right? And the state of Wisconsin as a whole has been voted the worst state for African Americans, right? So we understand that that happens because there has been intentional acts that have denied particular groups of people, particular demographics of people, being straightforward, Black and brown people, people of color, opportunity to really be able to experience what a high quality of life really looks like overall, right? So understanding the equitable opportunity is necessary. People is developing a people-focused or people mindset. So ensuring that there's community connection, that there is social capital, social cohesion that is happening, strengthening healthy social norms, right? That people can recognize that even though there may be a difference that everyone has, or whether that's in race or in gender or sexual orientation, but understanding that we are all as humans. There's an important thing that people must recognize, and it's that I want you to recognize my color, but acknowledge my humanity. And in that, I think that it's important that we elevate the discussion around social norms. And then finally, with place, making sure that we're improving the built environment and investing in parks and in housing and transportation, which fosters safer neighborhoods, which we'll talk about shortly. Next slide. So this is just the vision of Milwaukee, of the blueprint, is that ensuring that Milwaukee is a safe and resilient city where the lives of all residents are valued, promoted, and protected. We understand that this has not happened, but our vision is to make sure that it does. Next slide. So these are just the 6 goals of the blueprint. I won't read all of them verbatim, but what I do want to elevate is, for the sake of this discussion, is fostering safer neighborhoods, which is a lot of the focus around the community organizing, the community mobilization, civic engagement, community engagement, ensuring that residents are being put at the forefront, that their voices are being elevated in terms of what change looks like within their communities moving forward. Next slide. Here are the priority neighborhoods, and the 10 neighborhoods that we use in terms of from 2014 to 2016 to evaluate simple assaults, aggravated assaults, non-shootings, and homicides. These are all neighborhoods that have heavily been impacted by segregation and redlining, and understanding that Milwaukee is the most segregated city in the country. We struggle with spatial inequality, which many of these areas do not have the resources that are necessary to thrive, which leads to the engagement within risky behaviors, which draws out that violence. So these are the 10 neighborhoods where a lot of our work has been focused on ensuring that there can be major changes happening there towards prevention work. Next slide. So this is just an example of what the goals look like in the blueprint. Goal 1 being stop the shooting, stop the violence. So we have recommended strategies as well as goals, as well as action steps under each one. Next slide. And then the next part will be relevant indicators that are connected to the strategies and the action steps under each goal, and talks about the ways in which we analyze the data to bring about elevating those goals, strategies, and actions. Next slide. So here, finally, this is just an example of strategy 1 of one of the goals, and being use of timely, comprehensive data to prioritize prevention efforts. So strategy 1, letter A, talks about enhancing local capacity to access, analyze, and utilize violence-related data from a variety of sources. So how we put this into play is a program called Cardiff. And Cardiff is a model that came from Wales, UK, that analyzes aggravated assaults, and in Cardiff, they don't have access to guns, but they were noticing that bottles and knives were an issue in terms of those aggravated assaults. So using that as a way to bring about place-based solutions in their neighborhoods. Well, here in Milwaukee, we're doing the same thing, but we've added non-fatal shootings, child abuse examples. Data has been reported here as we're partnering with Children's Hospital, Frederick Hospital, and the Medical College of Wisconsin, the Milwaukee Police Department, Sheriff's Department, and other entities who are providing this type of information so that we can figure out the best ways to provide place-based and asset-based solutions within respective neighborhoods. Next slide. And ultimately, we're working towards elevating our violence prevention partnership. So this is bringing together, again, every representation from multiple sectors so that the blueprint for peace, the language of the blueprint for peace, can become a part of the everyday language of each organization within multiple sectors, so they can put the work that they are doing in conjunction with violence prevention. So it's bringing about an opportunity for advocacy, cross-sector engagement, movement building, and capacity building. We know that this is not something that one entity can do alone, given the complexity of violence, but we understand that collectively we can all make this happen towards violence prevention. Next slide. And finally, this is just a breakdown of the health system to prevent violence. So looking at multiple entities that have to be involved in the work around violence prevention, whether that's from emergency departments, public health departments, behavioral health care, but also early childhood development programs, community residents, social services providers, community organizations, schools, mental health services, academic medical centers. Everyone has to be a part of this work in order for there to be the transformative violence prevention that we all want to see instead of transactional. Next slide. And then finally, this is just 3 of the representatives that have been working in partnership with the Prevention Institute as well as RTI, myself, as well as Arnita, our new Director of the Office of Violence Prevention, and Quaco Tiangelo Cargile Jr., who is the Youth Injury and Violence Prevention Coordinator here at the Office of Violence Prevention. And with that, I will turn it over to Phillip.
Thanks, Jamal. And again, I said earlier that we wanted our partners to go first because it was important to understand the work that's being done. And I would be remiss if I didn't say how excited the RTI team is to have an opportunity to really add science to understanding the work that happens in community. And as many of you know, often we talk about the role of community organizing. Very little to any research has been done to really understand how it impacts outcomes. So I'm going to spend a few minutes because I want to make sure that we have plenty of time for questions to talk about the design and our attempt to really be able to codify the work that's being done, but more importantly, how the Acer framework in collaboration or combination with community organizing can impact ACEs and youth violence. Next slide. So specifically, our study has three aims. First is to retroactively measure Acer implementation effectiveness on child abuse and neglect and youth violence in Milwaukee using what's called an ideographic clinical approach. The ICT is important because it allows for within subject design where each community serves as its own control, and that'll be important, particularly in terms of rare events like violence, where you don't have a large sample size to really understand impact. It was critically important that we understood the work that had been done in the past before we ever moved in forms of finalizing our research design to really look at the effectiveness, not only this Acer framework, but also, we'll talk about in a minute, community organizing. Then once we had done that, the second aim was really to prospectively test the comparative effectiveness of the Acer framework, and here manifested as the Milwaukee Blueprint for Peace, and adding that in combination with community organizing in these 10 priority communities on community level child abuse, neglect, and youth violence, again, using the ICT. And then one of the pieces I'm excited about is more of a philosophy about how we think about doing community level work in my center is the importance of implementation science. And this is not implementation fidelity, but really using what's called a hybrid type 1 design to explore the barriers and facilitators to implementing community organizing within this framework. Next slide, please. So quickly, this design just again shows how we thought about this work and our aims. First, understanding the pre-work that had been done by Prevention Institute in creating this framework, and then understanding what it looked like in terms of from 2016 to 2020 with respect to how OVP was implemented in the 10 priority communities. And then more specifically, our research design of those 10 communities, 4 of them will have the Acer framework plus this community organizing framework, and then the other 6 will be Acer only. And so again, this comparative effectiveness design using this ICT approach will allow us to really look at change over time. Next slide, please. Again, this is the importance of, anyone who knows me, I always talk about context matters. What the implementation component, science component will allow us to do is understand what this work and outcomes look like in context. And so those barriers and facilitators to how we implement these strategies is equally important. And so our work and our data collection efforts will allow us to do that. And so again, when we're looking at findings and talking about how you replicate this in similar communities, that context will be important information for how to go about being successful. Next slide, please. Any presentation would not be worth its salt without a logic model. And so again, this is just looking at how we think about the work in terms of the inputs of the work of PI and OVP, and then really being able to document each one of those activities that result in these outputs that are in purple. And again, there are a series of outcomes and specifically looking at reducing ACEs around child abuse and neglect. Next slide, please. Just in terms, one of the things in terms of our retrospective, these issues about kind of structural racism, structural impediments, redlining being an important one, really came up several times. And next slide, please, and you'll see there's a significant overlay between communities that were redlined and elevated rates of simple assault, aggravated assault, non-fatal shootings, and homicide. Context matters, so it was important for us to put all of this in thought and consideration as we thought about what needed to be done to understand change in Milwaukee moving forward. Next slide, please. So where are we? We are in the early stages of this project. As you can imagine, COVID has changed all things, and even thinking about how to do community organizing during a pandemic has been a research study in and of itself. But to date, we've completed an IRB approval, systematic reviews in terms of archival materials, understanding the context of the work that's been done. We've completed our retrospective stakeholders interviews. Again, what was the impetus behind the blueprint? How did those stakeholders show up, and what were some of the key learnings? And also specific interviews with OBP and PI and understanding how the blueprint was implemented to date, and also the development of the community organizing piece. Ongoing activities include the following: looking at surveillance data, particularly existing archival data that we can look back over the 4 years before our study started and 3 years during our study. So there'll be 7 years of data that we'll look at to be able to understand the impact of this work. One of the important things is that we've created a GIS mobile data collection so that we are documenting every what we call community touch. So every time there's a community event, every time the interrupters go out, we don't bother them in terms of burden, but we're able to document where those touches happen and in which communities. That data is going to be really important to kind of look at the saturation and the impact of community organizing across these different entities. And then last, understanding the development of the training and technical assistance model around community organizing that PI is developing. So we've been doing an observational study to understand how they're engaging communities in its development. Next slide, please. So I went very quickly through our design because, again, we wanted to make sure we had an opportunity to engage those of you who've decided to listen to the webinar. And again, as I said earlier, the superstars of this presentation is the work that's been done by Prevention Institute and OBP. RTI has the opportunity, hopefully, to put science and rigor to be able to, again, codify the work they're doing. So on behalf of all three partners, I want to thank you for showing up today. And you'll see here, if you want to get in contact and learn more about any of this work, this will be a part of the slides, and so please don't hesitate to reach out. With that said, Sarah, I'll turn it over to you to open it up for Q&A.
Thank you all so much for that presentation. Really exciting to hear about the work you're doing and how you're really centering community voice and youth voices and systems change and looking at racial equity in this work. I think it's fantastic to hear about. And I know we have some questions already coming in, so I'll jump into those because I know we need to make sure we end right on time. The first question I think is we'll put to Jamal to start, which is around historical trauma. So have you built in the acknowledgement and awareness of historical trauma and its impact within your process? I think you mentioned that, so maybe you could share a bit more about what that looks like in your work.
Absolutely. Thank you, Sarah. I think it's impossible to have a conversation about trauma without understanding the historical implications of it. For example, especially with the 10 priority neighborhoods that we mentioned, all 10 are predominantly Black and Hispanic communities, right? So understanding to the point that has been reiterated, looking at how many of structural and systemic practices have impacted the Black and Hispanic communities throughout the city of Milwaukee, leading to segregation, redlining, but then not just there, we also understand the impact of mass incarceration, of the police community relations. And that's not something that has just happened within the last 20 or 30 years. We're talking about a practice that has happened prior to the civil rights movement, something that happened during the Jim Crow era, post chattel slavery. You know, and most people look at racism and always look at it from the lens of the southern border, but Milwaukee is recognized as the Selma of the North, as well as Wisconsin being called Mississippi, right? So then, and that's just with Black and Hispanic communities. But then we also have to make mention of, given that this is Native territory, right? When you even listen to the names of the cities within the state of Wisconsin, you understand that this is a major Native territory, and also understanding the implications of historical practice and trauma and injustice that has happened on Native Americans as well within the state of Wisconsin is all something that elevates historical trauma. So again, there's no conversation about any forms of trauma in the current context without there being reference to anything that has happened in terms of historically.
Great, thank you so much. Another question from Jessica. She says, amazing presentation. This team should be so proud of this work. Can you talk more about the plan to share back the data and the outcomes with the communities served? Data walks, webinars, town halls, sort of what approaches might you use for sharing that data back?
Yeah, I'll take a first pass at that. And we are intentional about feeding data back into the system. Again, as a general approach, we'll be working very closely with OVP and PI about where and how to do that as a project unfolds. So for example, we're in the process of analyzing our retrospective data and figuring out what parts of that might be useful as we move forward. And then once we move to the prospective study, we will figure out how what we call quarterly learning feedback opportunities to share with stakeholders in a way that doesn't compromise the evaluation design, but in the same time, as I often tell folks, we want to see if you do this in the way it was intended, did it work, as opposed to sitting back and saying, well, it wasn't done right. Well, what does that mean? It just means it wasn't done right. So we'll be very intentional about feeding back data to the system, particularly in terms of what the work that PI is doing in terms of the delivery of that second component, which is the part of the comparative effectiveness, to really make sure we are analyzing and answering the question about, does the framework plus community organizing have an impact on these targeted outcomes? And so Jamal, I don't know if you or Dana want to add anything to that.
Yeah, so I would say, again, it's definitely vital in terms of the reporting around data. For example, one of the groups that we work with directly is, I made mention of our Build Health Challenge earlier, and there is a community council that we have helped to develop in conjunction with the Build Health Challenge. And much of the data that has been produced and will continue to be produced will be presented to them, as well as the Cardiff group who works in the Sherman Park area as well. And the objective is for us to expand on Cardiff not just being in Sherman Park, but in other neighborhoods. So that's something that's going to be a continual practice. But the fact that we are already setting opportunities for there to be those public discussions, we understand are very critical in terms of this work.
Great, thank you. Next question, as other people in other places are really interested in learning from you, what have been the biggest challenges with this work? And in particular, have there been sectors that have been more challenging to engage? Not to call any particular sector out, but I know sometimes it can really be difficult to get folks to come to the table to a topic that they may feel like, well, that's not our job. So how has that worked, and what have been the biggest struggles with implementation you've seen?
So I can start, Jamal, but I'm going to actually pass off to you to talk about sectors. But one thing I just want to add is that when you're working with communities that have been impacted by high levels of trauma and violence, it can be difficult to get community to the table, right? Communities want to be involved, they're ready to be involved. And so I think, not necessarily in the development of the blueprint, because I think we saw a strong, like I said, organizing, and our partners at OVP were really masterful at engaging community and youth in that work, as Jamal described. But I think in this work where, as Phillip said, we're doing this in the context of COVID and a pandemic, some of our challenges have really been around, figuring out the right timing to get folks to the table to do some of the work around the resident leadership training. So I just wanted to add that piece. And I think why that's important is it really does require a patience and a willingness to work at the pace community and residents are working at. And sometimes our approaches, in public health and our grants and the way, we set up funding and things doesn't allow us to really do that. But that's something we really need to work on from a systemic perspective. And Jamal, I don't know if you want to address the piece about sectors.
Oh yeah, there's definitely been a challenge in terms of sector participation. That's mainly because there's been an indoctrination on what addressing violence looks like. For example, if we're talking about taking violence from a public health lens, well, that's a difficult conversation for somebody who's a part of law enforcement or who's a part of the criminal justice system, right? Because there has been this historical dependency on those systems addressing violence, right? So here's an opportunity, but that was also an opportunity to bring them in for the conversation to unlearn. And thank you, Nancy, I just saw your comment, for them to unlearn that historical practice or that indoctrination, because we have to understand that there are multiple ways in which we're looking at addressing violence, right? But then also, really challenging the employment sector as well, because there's always a mindset of in terms of like the ideal candidate that you want to see in your organization. Well, you also have a population that may not have been trained in the ways that you would like to see. However, they have the necessary attitude, they have the necessary capacity, they have the desire to work because they have families to take care of. Why does that not then become another population that we look to target? And we know that's a challenge to employers as well. So that's why we brought in the Metropolitan Milwaukee Alliance of Commerce, right? The largest chamber of commerce in the state of Wisconsin, to really head up the conversation around racial inequities. And when they did their survey in 2018 about the biggest disparities or biggest liabilities in the state of Wisconsin, the number one liability was racism. So if you know that that's a liability, what's going to be your next step in terms of addressing the racism that you know is problematic, right? So it's putting representatives within sectors in positions where they have to look outside of what has become their historical box, and getting them to think of what are some of the other innovative ways that they can also be a part of the efforts going towards prevention, and how their organizations and groups can really be a part of that on a more comprehensive, holistic platform.
Thank you very much for that response. I know we're just about out of time. I think my last question will be for folks who are interested in following this work and learning, with you along the way. What would be the best way for them to stay in touch with your team?
So I think in the last slide that there is a contact information for Jamal and Dana, which can get you quick and easy access to the work of both PI and OVP. We will be working from a research standpoint on our dissemination model, but more than happy folks to email me if anyone's interested in the design. Like I said, the work's much more interesting. We're just hoping to elevate it through good science, but more than happy for folks to reach out to Anna or myself around the research aspects of it. But both Jamal and Dana more than capable of sharing the incredible work they're doing in their respective spaces.
Wonderful. Well, thank you all again. Really appreciate your time today. I see lots of thank yous in the chat, so I think people really enjoyed learning more about your work, and we wish you all the best, and we'll talk soon.
Thank you very much for the opportunity. Enjoy, everyone. Take care.
Great. Bye.